G'day, fellas. If you're a bloke over 60 and you're looking to significantly improve your erectile strength and overall masculine vitality, then you need to listen up carefully. I'm Dr. Zoe Mitchell, and I've been a urologist for over 20 years now, and I'm about to reveal a daily exercise that takes just 3 minutes and can genuinely help you reclaim that confidence and vigor you've been missing. This isn't about quick fixes or magic pills, folks. This is a science-backed approach that actually works. Now, I know what some of you are thinking from the comments I've been reading. You want to see how this is actually done, not just hear me rabbiting on about it. Fair enough. So today, I'm not just going to explain it. I'm going to walk you through it step by step, and I'll make sure you understand exactly which muscles you're working and how to do it properly. Stick with me because on this channel, we're going to explore exactly how you can maximize your intimate health for many years to come. Right. Let me start by saying I get it. In all my years as a urologist here in Australia, I've learned that a man's confidence goes hand in hand with his overall well-being, and sexual health is a fundamental part of that equation. It's completely normal to notice changes in erectile function as we age, and let's be honest, many blokes feel frustration, even embarrassment when these changes happen. But I want to reassure you, you're not alone in this, and there are concrete, effective steps you can take. You see, factors like high blood pressure, diabetes, cardiovascular health, even stress and certain medications, they can all play a significant role in erectile function. Now, before we dive in, I need to mention something really important that I've noticed from your comments. A lot of you have been asking questions like, how do I make my penis bigger? Or, why is my penis small? So let me be crystal clear right from the start. Mates, what we're talking about today isn't about increasing anatomical size. That's not something you can achieve through exercise, and anyone who tells you otherwise is having you on. What we're focusing on is maximizing the health and performance you already have, making sure those vital systems are functioning at their absolute best. We're talking about better blood flow, stronger erections, improved firmness, and better control. That's what these exercises deliver, and trust me, that's what makes the real difference where it counts. Now, here's something that might surprise you. The exercises I'm going to teach you today, Kegel exercises, aren't just for women. For years, Kegels were mainly associated with women, especially after childbirth. But fellas, I cannot emphasize enough how absolutely vital these exercises are for your health too. In my experience, 7 out of every 10 older men don't realize that these exercises are especially important for urinary control, prostate health, and as we'll discuss today, male erectile strength. One of your comments really hit the nail on the head when someone asked, what is the pelvic floor? Great question. Let me explain that properly, because if you don't understand what you're working with, you won't get the benefits. The first step is identifying these muscles correctly. And this is crucial because if you're using the wrong muscles, you won't get any benefits. It's actually simpler than you think. Imagine you're trying to stop your urine flow midstream, or that you're trying to prevent passing wind. The muscles you squeeze and lift are your pelvic floor muscles, and they run from your pubic bone right back to your tailbone. A common mistake here is tensing your abdominal muscles, thighs, or buttocks, but don't do that, mate. It's a subtle, internal contraction, a feeling of lifting upwards. You can try this while you're sitting down, lying in bed, or even standing up. Have a go right now, just to get a feel for it. Squeeze and lift. Can you feel that? That's your pelvic floor. Let me introduce you to a fundamental element of male pelvic health that often gets overlooked. Your pelvic floor muscles. Think of them as the unsung heroes that support your bladder, bowel, and yes, even your erectile function. Strengthening these muscles through simple, targeted exercises can lead to remarkable improvements in blood flow, nerve function, and overall erectile quality. I had a patient, let's call him Bill, a 6-7-year-old retiree from Brisbane. Bill came to me pretty frustrated because he'd noticed significant changes over the past few years. After just 6 weeks of doing these exercises consistently, 3 minutes every day, he reported noticeably firmer erections and better control. He actually said to me, "Doc, I feel like I'm in my 50s again. That's not unusual, folks. When you do this properly and consistently, the results can be bloody impressive. Now, let's talk about why this works. How exactly does this help your erectile strength and vitality? It's all about optimizing blood flow, nerve health, and something called venous occlusion. When your pelvic floor muscles, specifically the bulbocavernosus and ischiocavernosus muscles, are strong and well-toned, they act like a powerful pump. During an erection, blood flows into the spongy tissues of the penis, and for a truly firm erection, this blood needs to be trapped there. Your pelvic floor muscles play a critical role by compressing the veins that allow blood to exit the penis. This is called venous occlusion, and it's essential for maintaining firmness and duration. A stronger pelvic floor means a more effective blood trap, which leads to significantly improved firmness and the ability to maintain an erection. It's like building a stronger foundation for a house. Everything on top works better, with more stability and rigidity. Now, if you're watching from Sydney, Melbourne, Perth, or anywhere else around Australia, or even if you're tuning in from overseas, leave me a comment with your city so I can give you a shout out in the next video. I reckon it's brilliant that we're building this international community focused on men's health. Plus, these exercises improve nerve sensitivity and coordination in the pelvic region. Think of it like tuning an instrument. Better nerve function means better sensation, better control, and a more responsive, robust erection when you need it. This can translate not just into firmness, but also into improved climax and overall sexual satisfaction. Now, I know one of you asked in the comments, why do I almost finish during sex but not quite? Like it stops halfway. That's actually a really common issue, and it often relates to exactly what we're talking about. Weak pelvic floor muscles can affect your ability to fully reach and complete orgasm. By strengthening these muscles, you're improving the muscular contractions involved in ejaculation, which can help resolve that frustrating not quite there feeling you're describing. Although we're not talking about anatomical size increase, which can't be achieved through exercise, the improved blood flow, enhanced firmness, and better control can certainly lead to a fuller, more optimal erection, one that feels more substantial and functions better. And the benefits extend beyond erections. Mates, strong pelvic floor muscles also contribute to better bladder control, helping with issues like post-urination dribbling or urinary urgency. They can even significantly help with premature ejaculation issues by giving you more control over the ejaculatory process. So it's really a win-win for overall men's health and well-being. Right, now for the main event, the daily 3-minute routine that's going to change your life. Consistency is the key, fellas. This routine is designed to be quick, easy to integrate into your day, and incredibly effective. Aim for 3 minutes once a day. You can do this anywhere, at your desk, in your car, while you're watching the footy on telly. The key is consistency, because like any muscle, your pelvic floor needs regular exercise to strengthen and function optimally. Now, I'm going to walk you through each step, and I want you to really visualize what you're doing. If you're watching this at home and you're in a position where you can try it, have a go along with me. If you're out and about, that's fine too. You can practice this later. The beauty of these exercises is that nobody can tell you're doing them. Step 1. The slow hold. 1 minute. We start with what I call the slow hold. Gently contract your pelvic floor muscles, lifting them upwards. Hold that contraction for 3 to 5 seconds. Really feel that squeeze. You should feel a distinct tightening and lifting sensation, not pushing down. Then, and this is critical, relax completely for the same amount of time. Don't rush the relaxation. That complete release is just as important as the contraction for proper blood flow and muscle recovery. Repeat this 10 to 12 times. This step builds endurance and control. When you're doing this, imagine you're drawing those muscles up inside your body, up and in, not down and out. Hold it. 2, 3, 4, 5, and release. Good. That complete relaxation between contractions is essential. Don't skimp on it. Step 2, the quick flick. 1 minute. Next up is the quick flick, which is all about speed and responsiveness. Quickly contract and relax your pelvic floor muscles. Think of it as a rapid flutter or a series of quick lifts, almost like a light switch flicking on and off rapidly. Do this for about a minute, focusing on quick contraction and making sure you've got a complete, rapid release after each squeeze. This helps with the quick reflexes needed for firm erections. When you're doing this, it should feel almost like a pulse. Quick squeeze, quick release, quick squeeze, quick release. Keep it going for the full minute. This might feel a bit tiring at first, especially if these muscles aren't used to working, but stick with it. You'll build up strength quickly. Now, I want to ask you something important so I can create better content for you blokes. What worries you most? Drop a comment with the number 1 if it's improving erectile firmness, or write number 2 if it's urinary control. This helps me understand what information you need most. Don't be shy, mates. We're all here to improve our health. Step 3. The endurance hold. 1 minute. Finally, the endurance hold, which helps build stamina for sustained function. Contract your pelvic floor muscles and hold for as long as you comfortably can without holding your breath. Aim for 10 to 15 seconds initially and gradually increase as you get stronger. Then, again, relax completely. Repeat this 3 or 4 times. This really strengthens the muscles for longer-lasting effects. When you're holding this contraction, remember to keep breathing normally. Breathe in through your nose, out through your mouth, nice and steady. Don't tense up your shoulders or your jaw. Just focus on that pelvic floor contraction. Hold it, keep breathing, and then release. Beautiful. That's it. 3 minutes every day. Sounds simple, and it is, but its power lies in its consistency and correct execution. Now, I've seen from your comments that some of you are asking, how long until I see results? Great question. Most blokes start noticing improvements within 4 to 6 weeks of consistent daily practice. Some notice changes even sooner, especially with urinary control. But remember, like going to the gym, the benefits build up over time. Don't expect overnight miracles, but do expect real, tangible improvements if you stick with it. Now, although these exercises are simple, it's easy to make some common mistakes that can diminish their effectiveness or even cause strain. Let me walk you through the most common ones so you can avoid them. Mistake 1. Pushing down. Don't push downwards. You're trying to lift and squeeze upwards, not force downwards. This is a really common mistake, and it can actually weaken the muscles or cause other problems. If you feel like you're bearing down or pushing out, you're doing it wrong. It should always be a lift and squeeze sensation. Mistake 2. Holding your breath. Breathe normally and naturally during the exercises. Holding your breath increases abdominal pressure, which is counterproductive and puts strain on your body. Just breathe steadily throughout. In through your nose, out through your mouth. Nice and easy. Mistake 3. Using other muscles. Focus only on your pelvic floor. Avoid tensing your abdominal muscles, glutes, or thighs. If you feel these muscles working, you're doing it wrong. This exercise is all about isolation. It should be a subtle, internal contraction. Nobody watching you should be able to tell you're doing anything. If you're tensing up your whole body, you need to reset and focus on just those pelvic floor muscles. Mistake 4. Overdoing it. More isn't always better, especially when you're starting out. Stick to the 3-minute daily routine. Overtraining can lead to muscle fatigue or soreness. Think of it like any other muscle group. If you overtrain, you'll just end up sore and tired, not stronger. 3 minutes a day is the sweet spot. And finally, a crucial and non-negotiable point, folks. Although Kegels are incredibly beneficial and a fantastic tool for preventive and supportive health, they're not a magic solution for every problem. If you're experiencing persistent erectile difficulties, severe urinary problems, pain during erections, or any discomfort in your pelvic region, it's absolutely essential to see your GP or urologist straight away. There could be underlying health conditions such as heart disease, diabetes, nerve damage, hormonal imbalances, or even prostate issues that need professional medical attention. Self-treating these conditions can be dangerous. Early diagnosis and treatment are always your best course of action for optimal long-term health. Don't muck about with your health, mate. If something's not right, get it checked out. I also want to address another question I saw in the comments. Someone asked, "How can I have an effective penis when I haven't had relations in several years?" I understand that concern, and it's more common than you might think. The truth is, sexual function is a use it or lose it situation to some extent. When you go long periods without sexual activity, blood flow to the area can decrease, and muscles can weaken. But the good news is, these exercises can help restore function even after extended periods of inactivity. By improving blood flow and strengthening those key muscles, you're giving yourself the best chance to restore erectile function. Combine these exercises with good overall health, regular physical activity, and if possible, gradual sexual activity, even solo, to keep those systems active. Fellas, taking control of your health, even the parts we don't always talk about openly, is a true sign of strength and self-respect. This daily 3-minute routine is a simple but incredibly powerful way to invest in your long-term erectile strength, vitality, and overall well-being. It's about building a fundamental health habit that empowers you in all areas of life, improving your confidence and intimate relationships. Remember, these exercises work best as part of a comprehensive approach to health. Combine them with a balanced diet, regular cardiovascular exercise, good sleep, and stress management techniques. Think of it as equipping your body with all the tools it needs to function at peak performance. Now, for those of you who've been asking about other ways to improve things, let me be straight with you. There's no magic pill or miracle cure for increasing penis size. Anyone selling you that is after your money. What you can do is optimize what you've got. And that's what we're focusing on here. Better blood flow means better erections. Stronger muscles mean better control. Better control means better sexual experiences. That's what makes the real difference, not centimeters on a ruler. I also want to mention something about diet and lifestyle, because I've seen some comments about things like bicarbonate of soda. Look, I'm not going to name names, but be very careful about home remedies you read about online. Some of them can actually be harmful. What I can tell you is that a diet rich in zinc, magnesium, and antioxidants does support male sexual health. Think leafy greens, nuts, seeds, fish, and colorful vegetables. Stay hydrated, limit alcohol, don't smoke, and keep active. Those basics will do more for your sexual health than any dodgy supplement. If this conversation today has empowered you and you're ready to take even more proactive steps for your men's health, here's how you can keep this momentum going. Hit that like button right now so the algorithm can show this to more blokes who need this information. Subscribe to the channel and turn on notifications so you never miss practical, science-backed tips specifically for men's health after 60. Leave your questions or comments below. I read every single one, and your questions often inspire future videos. What other men's health topics would you like me to cover? Drop me a comment. I'm here to help. Before we wrap up, I want to give a shout out to some of you who've been leaving comments about where you're watching from. I've seen comments from Mexico, Colombia, Puerto Rico, Argentina, Spain, and the Dominican Republic. That's fantastic, mates. It shows this information is reaching blokes all around the world, and that's exactly what I hoped for. Whether you're watching from Australia, the Americas, Europe, or anywhere else, we're all in this together, looking after our health. Thanks so much for joining me today. In my next video, I'm going to tackle another vital topic, navigating prostate health, when you should get checked, and why it matters. We're going to dive deep into the latest guidelines, common misconceptions, and what every man needs to know to protect his prostate. You won't want to miss that video. Stay informed, stay healthy, and keep taking control of your well-being. I'll see you in the next one, folks. Cheers.